Hello, everyone, and welcome to one of our podcast series that goes alongside the Find Your Way toolkit resource for Higher Health Education England. I'm Piers, I'm from Diversity and Ability, which is partnering on this project, and today we are joined by the wonderful Professor Hughes, who will introduce themselves in just a second. Professor Hughes, would you kindly introduce yourself, your role and your background?
Thank you. My name's Liz Hughes. I've been a hospital consultant for over 30 years in chemical pathology and metabolic medicine, but I'm also Health Education England's Deputy Medical Director, and I lead HE's work to widen access and participation, particularly into medical careers, but also into all healthcare professions. I'm proud to have been a disability champion in an NHS trust, working with others to consider the practical steps that we can take to make our working environment more inclusive. And as a person with a disability, I know this is not just about physical access and adjustments, but also about changing people's attitudes and creating a supportive culture. I've also been very proud to chair HE's roundtable on supporting medical students and doctors with disabilities. And I think we have a great opportunity to support all learners with disabilities, to actually help and encourage them to share their experience of their disabilities and how it's affected their lives, because this helps us in delivering healthcare to understand our patients and enrich the care that we give to them.
You mentioned about culture shift and building confidence. What role do you play in your work in encouraging that culture shift that allows people to be more open about sharing information on their disability or long-term health condition?
During my career, I've seen the positive difference we can make when we listen and learn from people's experiences. And I want to encourage everyone to feel able to speak about disability and what it means to them. And I also want more people to feel safe enough to speak about their personal information with us and be counted, for example, on the NHS staff electronic record. We know that people with disabilities, both students, learners, and healthcare professionals, are reluctant to share that information for a number of reasons. And I want us to be able to share that much more freely and allow us to help and support people in that situation, but also to learn from their experiences so that we can improve healthcare for all.
Talking about supporting people to access support and to disclose, what value do you think and how important in your view is funds and support mechanisms such as access to work and the disabled students allowance and other funding that's available from the Department for Work and Pensions for changing cultures, but also giving that support to disabled learners and practitioners and professionals?
I would really want us to be able to signpost staff and learners to the right support and resources available to us. And this includes funding streams like access to work and this disabled students allowance, because utilizing those funding streams can help and support both learners and practitioners in their daily work and make them much more productive. And I know myself, having been supported through access to work, that the support they can give is invaluable. Sometimes in very small ways, sometimes in larger ways, to actually help people do better and to enjoy their work and to help them support them to actually give of their best in their professional life.
You mentioned in that last answer that you yourself have gone through the access to work process. And I was just wondering, are you able to provide a little bit of personal insight into, those small things that access to work can provide, or that do change things in a small way, but can really radically change how productive and how comfortable you are at work?
I was having real trouble in outpatients. We had very old-fashioned furniture in the consulting room, which was at the wrong height for modern day computers. And I found that I was getting increasing back pain after every outpatient clinic. And similarly, we had no beds that were actually able to be adjust to help me examine patients. And actually having a workstation assessment and the installation of an electronically activated bed that I could change the height of the bed made a miraculous impact on my health and my productivity.
If you were to give one bit of advice or one pointer that someone can take away that's listening to this, whether they're a professional, identify as disabled, or a student learner who just stumbled upon this resource, what could they do after they finish watching? What could they do tomorrow to make that small change, that cultural shift, or a little bit of good practice?
I think the really important thing is to understand that people are supportive of learners and practitioners with disabilities. We have increasingly understood the wealth of experience that you bring to the health service. So if you need help, then please ask for it. And I think that will increasingly be seen as the norm. And so I encourage people to do that. Don't be afraid to come forward to ask for that help. And I would say to any others that are watching, please find out about these schemes, Access to Work and the Disability Students Allowance, because that can help both your student learners and your practitioners in order to become much more productive and support them to support their patients.
Such a great message to finish on. On that, thank you so much to Liz Hughes for joining me today to have this informal chat. And please do engage with the resource and support that is available to you. Thank you so much, and we'll see you in another session.